So many, the functional unit of your brain is called the neuron. Just as when you're building, right? The functional basic unit of that whole structure you're putting up is just one block. One block per mortar breaker. So you blocks, cement, blocks. In the same term, no, the brain, the basic functional unit of the brain is just a neuron. So many neurons come together to be a nerve. Okay, I'm gonna borrow 6 kids. Can I have 6 kids? 6 kids. Yes, come. 6 kids, or maybe more. 6 kids. Come. That's fine. All right. So this is the brain. I'm going to tell you the benefits or what the brain does for us. This is the brain, right? This is neuron. So many neurons neurons starting from genetic to here. So many neurons will join to form a nerve. To say there's like one block, you put it together to form one wall. Right? So if you have one wall, you have a whole corner of the room. If you have one nerve, you had so many neurons put together. So we have about 86 billion neurons in the brain. Isn't God wonderful? 86 billion. So what the brain does is, Jojo, stretch out your hand, touch something. So Jojo is touching something hot. He doesn't know it's hot for now. He doesn't know. So the neuron in Jojo here will sense it from the palm, because there are neurons in the palm. The neurons here will sense it. This thing is hot. Then it will transmit a message as an electric current. It travels so fast, so fast that I think it's 0.5 meters per millisecond. That's so fast. So it's going to send an impulse to this neuron. Then this neuron will touch this one. Hold hands. Yep, sending impulse through hand, sending impulse through hand, sending impulse through hand. When it reaches here, let's just say this is the spinal cord, because when message is transmitting from the environment, it passes through your spinal cord before it gets to the brain. Some of them, in the same way, when it's leaving, it also passes through your spinal cord. So your spinal cord is very important. So this is the brain. Finally, hold hands. When it gets here, this is the brain. It will tell you, this is the one who will tell you it's hot. The object is hot. So the next action is take off your hand. So it's going to transmit impulse again to Adwa, to Jeanette, to Israela, here. Then finally, when it gets here, remember whatever is coming says take off your hand. So the action is assuming. But you see, when you're cooking and you get burned, it's so fast. So fast that the moment you touch it, you withdraw your hand. That is how the brain works. So the image, the message that he transmitted here is motor. It's what we call motor. Motor function of the brain is what your brain tells you to do. Sensory function of the brain is what Jojo is feeling in the environment. So Jojo can feel hot. Jojo can be hurt, Jojo can be happy, or Jojo can also feel cold. That is the sensory part of the brain. Jojo is the sensory. My son here is the motor. Okay? So everybody can sit down. Thank you. I'm going to have Jojo get Jojo come. Okay. I'm going to use you as an example. This is how the human brain looks like. On the street, we're going to say this is the forebrain. This is the hind brain. This is the hind brain. Then the middle brain is inside. If you did I said the middle brain is inside. But down here, we don't joke with it, because this is the we have your breathing centers. This is the one that controls your heartbeat. This one, the one that controls your breathing, a lot of things here. And so over here in the movies, when people want to kill somebody, they hit them here. If you hit them here, that's very dangerous. So don't do it here. So medically or academically, this is how we will term it. This whole part from here to here, this whole part, we call it cerebrum. Cerebrum. All these places cerebrum. Then the cerebellum is lying somewhere. The cerebellum is here. Then the brainstem. This one. This is the brainstem. From all here is the brainstem. So we have 3 parts of it. This is the cerebrum, the cerebellum, and this whole thing here is the cerebrum. If you come to clinically, this is how we will, these are the parts of the brain. This is how we call it. The frontal lobe, the frontal lobe. Then from the middle down here, we call it parietal lobe. And then your what is the English name for it? The English name for it. We have to check here. The English name for headmaster. The English name for it. So it's called the occipital lobe. Alright, and then like I said, the cerebellum, the spinal cord exists here. Then the temporal vein, every part of the brain has what it does. There's nothing which every part of the brain has what it does. So these are the functions. I can't go through it one by one. But here, the temporal bone here usually is for hearing. Right? But you go higher for vision. This is the part of the brain when you see something, naturally you don't know what it is. But this part of the brain that receives the sight of what you're seeing is the one. This is the part of the brain that will interpret it to you and tell you, this is the part of the brain. And then here is for sensation, speech. This is what makes you understand. And this is what whatever you're studying is going to help you concentrate on what you're studying. Here, the frontal lobe, very important. Very important. Cognitive skills, fine and motor skills. If you go to school and you're studying, this is all you need. This is when the mouth planning, executive function. Oh, I need to wake up at 4. So some of us don't have an alarm, but naturally if you tell your brain, I'll be traveling tomorrow, I have to wake up at 4, and you fail to set an alarm. This is the one that told you. This is the one you're thinking. So he is the one that you've told. This one is the one that might wake you at 3:55 because you already discussed it. Yep, this is the blood supply to the brain. When brain exits your heart, it passes through these arteries. These arteries are located on your head. Very important. And then the moment they cross, they divide into so many arteries. Every part of the brain is served by an artery. So it's very important to know this, right? This one goes to the eye. This one goes to the vertebral artery in your vertebrae. Remember, this one goes to the occiput and the cerebellum. Posterior, this one goes to your parietal. The middle cerebral artery is in the middle, somewhere lying in the middle, and then anterior cerebral artery is the one that controls your frontal lobe. So this is how it is. So let me ask you a question. Yes. You see how? Let's just say this is how your artery looks like, right? This is how. So let's just say this is a long pipe traveling from. There is water traveling from here to here. I'm gonna ask you, what do you think? What are some of the things that will prevent the water from getting to the back if there is water traveling through this? What do you think?
When it is closed.
When it's clogged, yes. What else? The insurer paper in way a pipe. Oh, pipe. Pipe. Why a pipe? The Mujana, insurer wing. Airport she had. What are young pan and your back? 18 months soon from me. Yes, yes. What else? Bichema. Yeah. Anything else? If this is weak too, right? If it's weak, it won't be able to do his job. So that is what stroke does. Stroke depends on this. Either this is weak, either it bursts, or there is something that will clog it. Those are the three types of stroke that we have. The first one is ischemic. Ischemic means a clogging. When it's clogged, it means that blood cannot go through well. So that is very common. This type of stroke is very common. And then the hemorrhagic one is bleeding. Bleeding here, they also put a kind of say, the more pipe, and so a pipe in the middle, it's not going to reach in the back, right? And then the last one is TIA, transient ischemic attack. That one is just, if you see here, it's like, you see partially blocked. This kind of stroke, you can get it for like 2 minutes, then it goes away. So usually in the hospital, he will tell you, oh, I had a curtain, as it will be took it in the flashing medicine, then it went away. It is a warning sign that the blood flow through your brain in the artery is not enough. There is no space enough. So usually they will do ultrasound on your necks. I think your neck is very important because the thing is, if you have bigger arteries, right, coming from your heart through your neck, say actually I want neck and one clock here. A clock here, very, very dangerous.
Yeah.
So it's dangerous than the one that will happen here because the way this here, this is a major artery that supplies blood to almost everything here. It's a major one in here. I will say because I don't feel my majority of so we will come to all right, risk factors or causes. This is what I put down. Any questions about it? One of the major risk factors of stroke is hypertension. But hypertension, although of course stroke, usually it bursts. Modiano pie with team. So Modiano pie with team, and I say Modiano dorsum. And Modiano, you see, the one of the things that the brain is, they say, although I say, how should I put it? Or you're very sensitive. Very, very sensitive. So if there is anything going on either so baby and I'll bet disconnecting of rapid. That's why when your body is cold, it will tell you your body is cold, so shiver, I need heat, shiver. Then it's gonna increase the body temperature. Then you shiver. When you shiver, or closing the pores on your skin so that no more heat goes out. The brain is very sensitive. So a little bit of blood, if it's too much, it's going to push on the brain. And when the brain pushes down, so brain pushes down, we call it herniation. I don't know how to explain it in P. If it pushes down, it displaces it out of place. And that is when they say brain dead, sometimes coma and all those things in stroke. So one thing that hypertension does, the force that your heart is pumping is very, very high. Very, very high. And sadly we say you're weaker. This artery say you're weaker. Force and numb pumping harder until the time your arteries are gonna be weak. And when your arteries are gonna be weak and they are not able to do the job that they are supposed to do at that time. So that's what hypertension does. If you are also through car accidents, if you are not in 3 month pipe or bleeding on the 3, or if you need high blood pressure, then in 3 month pipe, then what do you do? Okay. The second one here, diabetes, high cholesterol. Diabetes, the sugar, high levels of sugar in your body for a long time damages your arteries, so it can lead to stroke. High cholesterol, I can say, is what we call clogged. Because if you have too much cholesterol, it can clog your arteries. Too much cholesterol in your body can clog your arteries. Coronary artery disease is when you have the heart itself, our pumping motor, or one person arteries or supply more energy. Until if you have problem with it, not until me and Mamuja from Emma money in the and they have him. Because I'm money to be pumping. So I'm money to be pumping and we call it hypoperfusion. That means your brain, sometimes it is not the stroke is not caused by either hemorrhage, so bleeding and I say baby are clocking. But some money to be near Jumaya. What I was a cold dream or to be pumping and Dawson. Until brain very hypoperfuse. That means it's not able to when young moja baby and finding it will say. And I feel hypercoagulable states. Some people naturally they clot easily. They have the potential. They are blood clots easily. Or when you have blood clots, if you have if you also arteries no tissues now, and if you are there connective tissue, they are there into the mouth clot easily. And a family history. This was what we were discussing on the line last week. Family history, I can connect it to. If you have with time, some people have very good genes in them. Very, very good genes. When you call on 92, it's only BP, only sugar. If you are so die one, so we need more than a number. Some people too, with time, their arteries or their blood vessels or their hearts gets weak. It's genetic. Sometimes it takes God to break that. And alcohol, drugs, and smoking. Thank God none of us here drinks. Thank God none of us here does drug, and thank God none of us here smoke. Obesity, cashier too much, and then chronic stress. Chronic stress. Sikane, yeah. We need vacations. We need family gathering. We need love. All those things we need it so we can reduce stress. If you have the time, if you have time on your hand, if you have to stay home, stay home. Well, sometimes if you don't feel like going to work, you can call us like that. Now they are doing home. Chronic stress, let's try to reduce it. And then sedentary lifestyles, exercise. Right. So you see that baby, I just sit in my car, I go when I come back, I just sleep, I eat, I sleep, no exercise, nothing. It's what we call sedentary lifestyles. And then this one, I think I spoke about it already. So if that is the arteries I spoke about on your neck, if there is something wrong with it. So symptoms of stroke depends on where the blood supply was cut. Right? This is a very good picture of what your brain does. Like I said, you have now a frontal. So frontal movement helps you pay attention, helps you plan, helps you decide and speech. And it says, blood supply no number. Now say a partner and do her. What do you think will happen? You can't. This touching is not, maybe it's not about you not being able to touch, but so be the second one. Yes, I have patients who will come in wheelchair then or be paralyzed. Who hear next time now, do you feel this? I don't feel it. Stroke. I don't feel it. And then imagine I can't taste anything. How? Vision. I don't usually see people with I think so far I've seen like a couple. Last year I saw one of stroke, and that it affected the eye. I don't usually see those patients a lot. What I see most is the movement, and then the temporal region is memory. So go on your stroke, kind of. You just have to just a local stories. I'll see you okay. The memory is gone. They don't remember anything. And then emotions, then movements. So if blood supply cuts from here, coordination of movement is depends on you. So one has out to animal, now one balancing. So people will just look at this. That's why some people give them walkers. And I say, cane. Because with me balance, that means that you only have stroke on a tip of This one is very important, very, very important, because your heart is what pumps blood to your whole body and breathing. And if stroke happens here, it's bad, very bad. If stroke happens here, what will happen, Mommy? Yep, you can't smell anything. This one, Stephen. If stroke happens here, what will happen?
You can't hear.
You can't hear. Okay, so symptoms. Obedience stroke, I better who say, Nipanania stroke. Stroke so they happen quickly. If you already are slow, a little bit slow, slow, which I say here, actually is now clogged, but still our point Kakrada on to when your symptoms Kakradi, but encounter. So they develop an acronym called BFAST, BEFAST, where the B stands for balance. Headache, the moment the symptoms starts, I twice now with me or many to bring me, no, it means swing. That is balance. And then blurry vision is eyes, eye vision. The E stands for vision. Then facial drooping, very common. Some people, I don't really have a good picture of this, but almost in the new chia. Yeah, if the new chia, Kakas or one Syria, baby, I want to make certain fun. I want to stroke by. One of the things that is very wonderful about the brain, sometimes we dream, I don't know how God made it. This part of the brain controls my right side, and the left side of the brain, so we call it contralateral. So if the stroke happens on the right side, the left side is going to be weak. The reason is when they are sending messages down, they cross. You cross it. Say the enemy say yeah, you may be cross it. Across it back no back one for left, back one for right. That's why it happens like that. And then arm weakness. Some of them when it happens, say baby stroke so this is the God forbid. So you when a stroke so we are normal. So we do have your much control, but this will do what you say, as and then select speech. Some people will be, we call it word salad or piquant salad. Word salad, the speech is not really clear. You so how do I confused, very confused, like I said, memory loss. These things. This shortness of breath, nausea, vomiting, fatigue, and palpitations, system will come and go penny. So we say, but one year, because these, well, even if you're pregnant, you can't get it. If you're pregnant and you are in your third trimester, we can 40 weeks, and I know we won't make 10 times, which I let me with papa. And nausea, vomiting, you can easily throw up, then you are tired. So these are not really telltale signs. Let me based on that, shall I telltale signs of strokes are. But it can, when they happen like that, they can be part of it, and the loss of consciousness. Some people too, when they have stroke, they cease, they have seizures. And then, how do we diagnose it? Uber Hospital, the first thing, stroke, time sensitive. The earlier you discover it in the person, the earlier salvation will be and you do the person a great favor. So the first thing they do, they say, obey your CT scan. Within 25 minutes, they do it because they want to know, say you won't just new one, I say, your heart is now called here. And then later on, they will have to repeat it. So usually what they do is, before, if they know the cause of it, then they treat it because say umoja nebia you can they will check your blood pressure. Some of them if it's umoja you know about checking the pressure and then also some people can have some people that are solid one they was here somebody's normal. The stroke patients they was here somebody's even abnormal digits. Some people can have a blood pressure of 200/120. Because I said will be abnormal blood pressure. So one of my friends will tell me if my blood pressure, if the higher one the top one is 120, that means it's high. Say when the blood pressure is 120 over 80 is high. The blood pressure is always 90 over 60. Yep. Some people can have that 200 over 119, 200 over 120. So usually what they do is, the first thing you have to do is control the blood pressure, treat it, and then so they will give BP medication. Then when they realize that it is not related to blood pressure but it's related to the clogging aspect, they have to give you medications. They have to give you medication. So those are anticoagulants. And then someone just sometimes you need surgery. They have to take you to the OR to drain it or to clip. Actually, this is a clip. You're calling for clipping. I don't know when you have surgery. If you want to say an American say a shape, clogs now clog the show come one. I just say mechanical, but this is a free free. Sometimes say if you are, and they get shame to make it straight. If you are higher, you're actually now one and I'm one cantino. Say you don't quite this as a balloon shape to make it open. That one is angioplasty and then surgical vessel repair. This is you either clip it, you have to clip the artery. And then complication is, how do I say it in P? You should so, right? You should so, You should so a free movement. With the first one, paralysis, so and then you will not be able to speak well because the part of the brain where the stroke happened is where the speech is. And then sometimes people are not able to swallow. So Abasana ain't mean more for an number of family. Yeah. Another food? Yeah.
Thank you.
Oh, lasagna. Lasagna. Mashed potatoes. You can't swallow it because if you swallow it, about foul lanterns. We swallow the name is foul lanterns. So these people, they want me pure food. Again, yam. And I say, I'm quite take one. And I'm put on potter. I said, I yam and then I and then one of the complications is memory loss. So this one we are all going to discuss it. What are some of the things? Let me skip here. What are some of the things that we can do to prevent it? I'm almost done.
Exercise.
Jenny, where you how? And then you put your exercise. We decided that later on, I asked him, are you going to do it? He said, no, I'm not going to do it. It's not easy. The decision is not easy. Yeah,
this one we went there.
Susan Penson,
the Francis did it, Charles did it.
Oh, he came
later.
Yeah.
Good luck.
So how many of us will be exercising today?
I'm number one.
Mama, okay.
I always do it with my mouth.
Exercise. Yeah, exercise is the best medicine. I'm telling you. Exercise is the. Some people.
Doctor, repeat that again. What did you say?
Exercise is the best medicine. Yeah. Long life. I said, Nyame Mount Patenting, oh, good genes are glory be to God. Nyame Mount Patenting and glory be to God. But say, if you are exercise, if you choose, let's say, exercise and good food, water. Number one, exercise, best medication.
I have a question. Most of the time we talk about exercise. Which specific ones?
Which line? If it be aerobic or non-aerobic. Aerobic ni boko. Then aerobic no.
Walking.
Who said walking? Walking. You go what we do. Walking. You say walking like this. Walking there. This kind of exercise. They just say we are on anti. We are become bronze. Yeah, exercise. But brisk walking. So, I was skipping rope, jumping, running, Very important. Dancing.
So if they go to the gym, they lift those heavy stuff.
Yes, that kind of, yeah, that one too is exercise, but I know of the day muscles. Muscle strength is really good. Yeah.
What about climbing stairs?
Yeah, and also exercise. And it's really good. Building the muscles is really good. I read a book, I don't remember the title, but it came out the exercise. This. What else? Anything else that we can do to prevent stroke?
What about fire?
Bring.
I just want to say,
Bring up.
then we back on.
Fire.
Fire.
Fire. Kind of fire.
Hey, Daddy. You explain it that when we read the adult session, but she knows it, so yeah.
What is fire?
No, yes, yeah, but kind of for also get question would I say fireworks.
Fireworks. Okay, anything else? Anything that we can do? Millie?
Yoga.
Okay. Yoga is good. Yoga is good, but yoga as a more of yes, stretching. Yoga need boko. But yoga is good. It resets your brain. Yes.
Swimming.
Push-ups. Yeah, push-ups. So yeah. Swimming too is good. Swimming.
Arena.
Swimming.
Roller skating.
Health expert here. Biking, yes, biking. And I'm watching that Sophamia. What can we do to prevent stroke? Eating good. In your limit is lesson. Huh? Vegetables. Hey, Yebedi. Vegetables, fruit, Yebedi. It's not easy.
I had a question. Based on how we were raised, our culture, and the food that we've grown up with, we are here, okay? But unfortunately, a lot of us find it difficult to eat the salad, the fruits. Because it feels like it's light. It does not carry weight. So when you start eating it, after a while, you feel hungry. Why? Because we've been nurtured with banku. Banku is a form of, for your sake, it's a form of cornmeal. You know, we're used to starchy food like yams and the cornmeal is a form of polenta, but has been fermented with okra sauce and all that. And when we eat that, we feel satisfied. And that's how we've lived. And that's how we've grown. They say, because of our work schedule and stuff, we find it difficult to exercise, even though it's a form you have to discipline yourself. So I'm just throwing it there. How do we curtail our diet for the sake of being healthy and start eating the leaves and the fruit? Because yes, I'm punching the cake. Muslim fancy, sassy, running food, you do. So being here for the sake of long life and being healthy, therefore, to avoid having a stroke. How do we make adjustments? Because breakfast for him or her is not bacon, egg, and cheese. I know some people eat plantain and spinach stew or bacon and snap in the morning, cake and stuff, and that can carry them too. But because of it, we say eating certain food can damage, our arteries and stuff like that. So how do we make those changes without missing a traditional food,
So this, what you're saying was hard, but when I started doing that, the way I introduced it, I cook broccoli. Instead of taking three turkey or 3 fish, I'll take 2 fish. I'll replace the other fish with carrot and little quanim or broccoli. That is how I started with one. And then when I'm eating rice soup, some I don't know, I may steam cabbage. I steam cabbage, I steam French beans, and then we tea rice and I'm tea steam now. Now I said the extra the cabbage that I steam movie. We can't eat enough to say rice. We can't any rice in enough. So it's not like I'm going to eat the cabbage on the side. Be a media no kwa uncle. Now let me with rice. I introduce it with the food that I like. That's how I started. Because if you imagine standing, now we are prepare salad. It's going to be 1 year, you don't even have the time. Go back and it takes us 3 hours to finish it. But here in this country, if they will put chicken on the frying pan, 5 minutes, 10 minutes, and when we buy it, they are not quite check. So maybe I might not have time to prepare a backline. We will have vegetables, so I will add it to the soup. I will add it to what I'm doing. And when I finish, that's what I will serve myself with. If anyone has any contribution, it's welcome.
Okay. What about, I don't know if that is the right word, portion control?
Reducing the portion.
Yeah, reducing and then eating on time.
Mm-hmm.
Like, the go over food, and I don't like cry no food them. But if you can eat on time around maybe 4, and then it's not big, fufu starch in like a creamy, and then the protein, and more. I think we can also start with that. And also, back home in Africa, right? Our forefathers were eating all this food, but they were able to, advance in their ages, 99, whatever it is, right? Because of the weather. And when they eat, they walk about. But here is when you eat, you are in your room, right? You don't even get out to walk around, right? But back home is different. We eat all those food, but we are still active because we walk around, we have people, we talk for about 45 minutes before you even go to bed. But here it's not like that. We eat, we sit in the chair, and then we watch TV, or even you sleep, And as we said, we go to work, we carry heavy food to workplace. We are in air conditioning, we are eating all those dirty food. So my thing is that we need to cut it, 10, make it 10, but portion control, but, go to the end.
Yeah, I will also want to recommend, especially to those who like to eat fufu. It's a powdered, whether potato or whatever it is. And back home, we use plantain and cassava. Here, what we buy is not that cassava we know. And we don't even have plantain. So when you go to the market, we're throwing away stuff. We give these the peels to goat and sheep, and when they eat, they don't even fall sick. You see, if you haven't done that before, go to the market, buy the plantain, cut into pieces together with the peel, blend it, take more so. Make sure you have more of the plantain, and then use a little bit of the powder, the flour, whatever. You're gonna have food you never have even back home. Try that, and it's healthy, better than the raw powder that we cook. Amen.
Yeah, what I want to add to that is that you need to discipline yourself. You see, discipline is, I think, one of the, you just have to make up your mind, right? You are health conscious. So, say, if I eat this food, definitely I'm going to pose a problem to my health. Discipline yourself. And God has given us that spirit. It's a fruit of the spirit, self-control. You see, once say, me the fufu, them time, yeah, or me, yeah. I want to If you know, you eat fufu, you like fufu, you have to also look at the time. You have to eat at a time that the food can digest. You see, not that you just eat fufu at 10 p.m. You are going to sleep. It will build up. It will build up a in you. You see, so the food is good, but let's be disciplined. When you discipline yourself, you can.
It's always recommended to finish your meals 3 hours to bed. We are 3 hours or maybe more, but at least it has to be 3 hours before you go to bed.
Yeah, I also say that in as much as we are advising each other, there are some people who try to cry when they do. So to those the stubborn ones, your best say try and eat early. And we didn't swallow. Yeah, so then. We didn't so I tried to walk around because Obu or what she said before and I said bank no yen is then baby Obu or salad no yen is the old and you know omo ya cashier omo the fufu na no be the best say you begin in 10 and I didn't so I will walk around and even and take a class and I have better needing in 10 also. Thank you.
I have a question. Why is fufu the main? Does fufu cause stroke? Does fufu cause stroke?
It's not necessarily fufu, but what you are trying to say is that so let me add one thing. You see, let's balance our food.
Does carbohydrate cause stroke?
No. What you are saying is that we have to balance our diet. Balanced diet. You see, when you balance your diet, it helps. Oh, I'm from here. Wake up. Oh, yeah, go one way. And then you're heavy. Oh, now I build it. I said, cholesterol, no, with you. I feel a block of artists. Oh, so, I mean, we just have to discipline and let's balance our diet.
Questions?
3 things I recommend. Exercise, number 1. Water, number 2. Then balanced diet, number 3. 3 things I recommend. Exercise, 1. Water, number 2. Then balanced diet.
Question time.
I want to know what is the cause of having a mild stroke. Mild stroke. How did it happen?
Mild stroke, I think it was in one of our slides. Mild stroke, that means the stroke is not that big, right? So it means that the blood supply was mildly cut. When I say a coin down, that part or that is mild stroke. Like it wasn't, if the blood supply they're supposed to be 100, maybe you were having 40% of it. And to bring your symptoms, this is it. Mini stroke. We bring your symptoms, but we all the symptoms. Because the more blood supply, but so there's nothing going, so it's slow. Yeah, it depends on that part of the brain that is not that where the clot is happening. Yes, it can cause it.
Because I have an experience. My tackles the right side is paralyzed, but this place is affected the left side, but I had it with the right side.
Some people too also get massive stroke or multiple, and then maybe by then mojano area a bell cutting. Multiple parts can happen like that. So if the person is going to have weakness on the right, maybe they will have complete paralysis on the other one. So you see the thing is, hospital on the end in Tema, on bit master of AG brain. That's what they do. They say they are clog in a shame. They can give you medication a ben nani moja TPA, it's a bit man nanino. And then if you are, it's not going to take maybe 5 minutes and a bit if you can bet. And Nanina, and Nanina, I get one. The Mujan to make for SRV. one of the things, the main thing is that brain part is not getting oxygen. And to say, we do hospital when I amount additional oxygen, so I one. So with time, most of the time, yeah, physical therapy and I do rehab to help you with the speech and to help you put things together.
My own, the arteries, this side is crooked, the vein is crooked like this, so they inserted some tubes here and they inflated the
balloon shape.
Yeah, the balloon shape.
Femoral artery. That is a big artery. The money and the wire. I film I do come. The wire film I do come. Now you share what is actually going on. See, go atherosclerosis. Just say be a wire as a complete blockage, but arteries and was a big at the time home. See the balloon, a shema. Now you pump a balloon. No way you wire nothing. The balloon back out. The balloon or the shema. Me, a dyslexia, you start getting a sentence, then you go and repair it.
I'm not saying it's a moody and a best. To say to cut you and say you said it.
If you are a cat, be a cat, cat be a cat, but this why I'm not shaming you, so it can be risky. Because later on, so they go ahead to cause a problem, actually, maybe a child. Go out to meet the fire free. Once a while, because I put me when you're black clothes, and one cassette to miss out of and it depends on patients, you know. It depends on the condition, it depends on what other ideas are women. It depends on the condition of the patient. That will make you choose either just surgical repair here or just do the angioplasty.
That much time.
With time, it gets some of them return completely back to normal. Some of them to maybe 90%.
All right, thank you.
And Papa, all these that we say miraculously, that's why we are Christians and we pray. God also does his miracle by also healing us.
I have a question. If somebody has high blood pressure and the person is not on medication, can it be reversed on its own by taking garlic and natural remedies, or once you have high blood pressure, you have to be on medication? Can you be choosing how long to take it and stop because you are praying, stop taking it and trusting God for? How does that work with high blood pressure?
Where the field that I work in, you can't take high blood pressure medication and the other one say angina. If you're taking it, what I know is you can work on it, then they can reduce the dose, or maybe just give you something like as a heart vitamin. You just need it. That's what I mean. But say completely without doctor's recommendation or without I have blood pressure most of the time. Say like sometimes you can have blood pressure, maybe your kidneys are the one causing it. So if they find a problem on your kidneys and treat it, the high blood pressure goes away. Sometimes you get it through pregnancy. Once you deliver, the high blood pressure goes away. But if it is not from secondary causes, then there is nothing wrong with you, they didn't work up, everything is negative, and your blood pressure is high, that's primary hypertension.
A method of treating sugar.
Another topic.
That's another topic. Very big topic. So what we do is that if you have any further questions, you can see our doctor, and then she will give you further explanations that you have. But the last question is that
Spider, Anansi Achim. Yes. Anansi police because people say Anansi Achim. What is that?
Anansi Achim.
It's a sign of stroke.
Once normally, if I say you have poor circulation or you have nerve problem, you would say, go ahead. Some of us, when we go to work, we go out, we put meeting to now with that bed 30 minutes. Now, Jenny. And not make my own nerve problem because what put you pressure? What now? But here, nerves and no fun at the back, now follow to one bamba nerves. So if you put pressure on it or to such it can be with medicine, desensitizing, it can be sensitive until because of poor circulation. That means the blood flow through that part of the body and it's not good and that is one of the things that can give you numbness. Okay. So it's either nerve or poor circulation.
Okay. And as you follow. And as I show.
One said the nerves that innervate your hand and now what and anything you're able to do.
So what can they do to stop that? They have to. Like exercise it. When you exercise it, you naturally opens your blood vessels for more blood to flow through that part. If you also connective tissue disease,
so, doctor, the last question. Most of our parents, right? They listen to people on YouTube. And then they tell them, oh, because of the salt that you are eating, I have this medication. You know, they listen to, instead of going to the hospital for them to get explanation, they rather resort to social media, what somebody is teaching there, and then they take it.
Is it the garlic and the ginger she was talking about?
It's a lot. It's a whole lot.
So, you see, the thing is, this is how I see it. So, eating the garlic, those of us who are young, those of us who don't have high blood pressure, one of the things that you can do good for yourself is that is when you start eating the garlic, the ginger, you eat well because you don't have it. But once you have it, ginger cannot treat it. Garlic cannot treat it. You can't treat it. Unless you didn't have high blood pressure, didn't have diabetes. And now you had it, but you've done something. Why we are one case why exercise be what did he be now blood pressure used to be. And I say it was blood pressure was maybe you were reacting to stress and temporarily it was there. But say when you are diabetic and you exercise and you lose weight, then you go and then you say your A1C is low. Your A1C is lower. You've done well. You've actually healed your body. But for hypertension, it's more complicated. Hypertension is more complicated. So when you have it, if you have a borderline, we are 130/90. You can work on it. You can completely cut salt, replace the banku with the vegetables and the fruits. You can do it. Then when it's starting, that's a good treat here. When it's starting and you treat it, it's better than when you've had it for 10 years. What did he have via Usipa? What's how you can see you put on weight, you've been eating anyhow, then the high blood pressure is even a little bit higher than when you started with. And then now you're trying to completely, you can actually stop it. No, I'll not say stop it, but you can work on it. You can work on it. If it's caused, like I said, if it's caused by lifestyle, if you are diet, you're not exercising, that is what is giving you blood pressure. And you start exercising, you start losing weight, you start eating well, it can go away. But I will not advise you to eat bamboo, eat what you like, the later on go and chew garlic and go to bed and say, when the garlic no yet treatment. No, it's not gonna work that way.
Okay, one last question then. Well, there's a mic there. Thank you.
Well, yeah, Doc, I need you to clear this people's mentality regarding taking off high blood pressure medication. There is a notion that many men who have been diagnosed to have high blood pressure are given specific medications to treat it. But people believe that it impacts on their medically through the first place, and also if you refuse taking
Please explain.
can it impact on your health issues?
second one, yes, blood pressure can affect man's performance, yes. Because
Blood pressure or the
all of us
medicine?
know that exercise on this one. So the exercise, so when you exercising, blood pumps, like you need blood for your muscles and all that. And you need to use another thing. Fire. No, not fire. Well, yes. You need standing. You gotta stand. You need blood flow through the veins for erection. So if your heart is not pumping well, you can't erect fully or you can't erect maximally. It's going to erect, but you can be weak. You're going to have weak erection. Yeah. That is different from erectile dysfunction. Some people don't have high blood pressure, but they have erectile dysfunction. That is the problem of the thing itself. It has nothing to do with high blood pressure. But high blood pressure can actually cause erectile dysfunction, especially bad ones. Bad high blood pressure can cause it.
So my his question was the medicine. That's the medication. Taking blood pressure medication.
Does it help?
Can it cause
we call a medication a form of hydrochlorothiazide. Yeah. It affects your manhood. It also increases your sugar levels. So some of them do, but some of them don't.
So what would you advise?
So your doctor will give. Sometimes they start, especially the young people who have high blood pressure, they can start them on the hydrochlorothiazide because they are young. But in grown-ups, your doctor will actually give you a specific one. Or when you start taking one and then you realize a change in your system, you can talk to your doctor. He has to change the medication. He has to change it. Because every medication has side effects. Yeah. So the real doctor is you.
Oh, put your hands together for our doctor. Are you happy to be here? Are you happy to be here? Yeah, I'll handle it. Oh, let's put our hands together again for